Let's just get some reaction to it, though, with Niall Dickson, who's the Chief Executive of the NHS Confederation, which represents organisations across the healthcare system. Neil, I know you were just listening to that. Open question. Is there anything that you took out of that we should have noted?
Well, I think the mildly concerning thing is increased traffic. There's always been this argument about if you lock people up, will they stay locked up for a long period of time? So one absolutely hopes that that's just a blip, and you can never take much, frankly, from one day's figures. I think the other thing is mildly concerning, increased level of admissions to hospital. I suppose there was just a hope that this might go a bit flatter than we've seen, and there was a period where it even went down a little bit. Again, one day's figures, you can't go wild about that. I think the honest answer is we are likely still to see an onslaught, so people shouldn't get really dramatically, oh dear, nothing's working, this lockdown hasn't worked, or whatever word, social distancing hasn't worked. I think we'd say you have to bear with us. This will have to last a couple of weeks at least, and then at that point, hopefully, the NHS will not have been hit by the very large numbers, which will mean it cannot cope.
But we do expect the numbers to go up. Actually, hospital admissions, in a way, is one of the more interesting metrics at the moment, isn't it? If you're trying to measure the scale of this, because it is not as a delayed one as deaths, fatalities. But it is quite a concrete one. It's not one that just moves around with the way you're measuring it.
No, I suppose, and I'm not a clinician, so I'm repeating what clinicians have told me, which is that so hospital admission is usually 12 to 14 days after you've been infected. So 5 to 6 days from the moment you're infected, then you show symptoms, another 5 to 6 days, as it were, of becoming ill, and then hospital admission. And for the much smaller number, obviously, who die, it's another week after that. So you're still looking back in time at these admissions in terms of what infection, and one would hope that the effect of everybody staying at home, or vast majority of people staying at home, would have an effect on admissions, and that you would see a reduction in the level of increase, as it were, going forward to hospital, so we can flatten off that curve.
Let's just talk about testing. Why don't you give us the reaction to this change today, by which hospitals are not capped at 15% of their test capacity being devoted to their own staff, but whatever they think is due, whatever they judge. Is that going to make much difference to the amount of testing that is done in total, or the amount of testing of medics?
I don't think it'll make difference to what testing is done in total, which depends on what there is available. But I think it does give flexibility to our members to decide what they need to do. And there is frustration, real frustration, I think, across the NHS about the fact that people who could be delivering care have found themselves in a position where they're not sure whether their relative has had it, and therefore they're self-isolating for that reason and so on. I heard today of someone who was a NHS person who said that their daughter had had a temperature in one day had risen up, and as a result they'd had to isolate themselves for 14 days. If we'd had some form of testing, and certainly testing of her, that might have absolutely shown that she didn't have the virus, and therefore that individual didn't have to isolate themselves. So I don't think testing we shouldn't see as a panacea. Let me be clear about that. But it is one important weapon in this business, and the type of testing you do, I think, as you were reflecting in Jeremy Hunt's words, are different at different points. And the new test, and again, I suppose frustration, why can't it come sooner? I know they are testing it, so we absolutely don't want a bad test coming out, and that's right. But an antibody test, I think, will be really important to show not least staff who have had it.